Hello, this is Dr. Sean McCorkle again here at Summer Creek Animal Clinic, and today we're going to talk about cat dentistry. There are a few unique things to cats. Most of what we've talked about previously with dogs is going to apply, but I want to talk about a few things that are unique to cats. And so this is a cat skull. First off, you can see that cats have a lot fewer teeth than dogs, which is nice. There's less to deal with. And of course, things are always a lot smaller in most of our cats. So there's one thing I want to talk about first, which is teeth fractures in cats. Similar to dogs, but more commonly, cats are fracturing these front teeth or these big long canines. And mostly it's cats that have outdoor exposure or a history of outdoor exposure that are getting into scuffles with other cats or having traumatic experiences. Sometimes they will fracture these front teeth. And it's really important to be able to identify that in a cat because the pulp chamber in a cat canine tooth is very, very long. So even a small fracture in one of these canine teeth oftentimes will kill the tooth and it gets infected. And so most of the time it either needs to be root canaled or extracted if it's fractured. The other thing that's not completely unique to cats, but we see more commonly, is called tooth resorption. Now that is when the body, for probably a variety of reasons, it's not 100% clear as to exactly what causes this, but the body will start to destroy the tooth, or oftentimes multiple teeth. And this is really important because if the destruction of the tooth starts to affect the crown, or the part of the tooth that you can see in the mouth, that is an extremely painful process. And again, just like with broken teeth, oftentimes you as the pet owner don't realize it. You may notice that the cat's drooling a little bit more, sometimes dropping the food, not eating as ravenously, not as friendly, not wanting to be pet as much, hiding more. Those are all potentials, but oftentimes cats are hiding the symptoms. But rest assured, if we have a resorptive lesion in the mouth, it's very, very painful. And so this is an example here on a cat that we did a dental on that has tooth resorption. So it's this really far back first molar on the bottom, and it's really hard to tell, but the center of the crown here, there's this black hole. So the tooth is completely destroyed here in the center, and then there's a lot less density in this tooth right here. And so this entire crown surface, what I'm outlining with the arrow here, is being resorbed. And so this is an extremely painful process for this cat, and that tooth needed to be extracted, which is what we did. So if the crown is involved, it's painful. If the root's involved, but there's infection around the root, then that also can be painful. And the answer to addressing this is removing the tooth. There's really nothing else we can do. It needs to come out. What you can look for in your cat's mouth, if the crown's involved, oftentimes there will be a little fleshy pink tissue that's covering up the resorptive area. Not always, but if you see an area that looks weird, a little bit more pink, and it's kind of on the surface of the tooth, that can be a really clear sign that there is a problem. And even if it's not resorptive, it definitely needs to be addressed. So that would be a reason to see your veterinarian.